My name is Evan Ridge. I am a graduate of Rutgers Dental School, 2016. I did a residency at the Bronx VA Hospital for a year after that, and I've been practicing in Philadelphia for 6 years now. Yeah, I had a lot of implant placement experience back when I was in residency, but I hadn't placed any since graduating. I worked with a periodontist in my office for the first couple of years after going to private practice. Just to restore them and a planned placement with him, but I never actually placed them myself since graduating residency. So I was looking to get another just hands-on refresher course before I started placing them in my practice on my own. This was definitely a helpful course to do. Yeah, the first 2 days were definitely helpful. It just gave, first off, a really well-rounded basic refresher course on implant physiology, implant design, patient considerations, all the complications that you want to know about ahead of time, and just kind of give you that good backbone to really feel good going in and placing implants, and then also just understanding why we recommend to do certain things, why we recommend not to do certain things, and just kind of help everything come together a bit more. Just made me feel comfortable again using the hand pieces that we were going to use here, remind me what it felt like to place an implant before doing it again on a real person for the first time in 6 years, and just kind of definitely prepared everyone for the surgery day. Yeah, it was great. I wasn't sure how many implants they were going to have lined up for us to place. We each placed a number of them, and by the last patient we all felt really good, and the instructors were just kind of there to oversee, make sure everything was good, but really we were on our own to make our own decisions, and if we had any complications or anything, we could just turn around and ask the instructors for their opinion and help. But it definitely, the instructors were definitely great, and they were just as hands-on as they needed to be, but really allowing us to kind of run with our own ideas, and then they would just give us their tips and tricks behind the scenes. And I really also thought I would only come in here with kind of a basic understanding and confidence level to do just straightforward implant placements, but they really taught us a lot more on grafting, sinus lifts, and kind of set the expectation that we should feel confident and comfortable to do even more than just what I came in expecting. And they definitely gave us all that, all that training and education as well. So I'm definitely going to feel more comfortable walking out of here doing more than just the basic implant placement like I was expecting. Yeah, I mean, again, being that I haven't placed implants in private practice, and when I was doing them in residency, everything was kind of taken care of for us. Having some reps here definitely helped us just get an idea of what's out there as far as support, as far as equipment, materials, software, all that kind of stuff that I wouldn't have any exposure to yet otherwise. It was great to ask them all the questions that we needed. It's been really good just helping us get everything set up and answering the questions that we had. Like I said, it was a really well-rounded course to get the fundamentals and basics down to start placing implants, plus a little bit more. So this was for a week, a 3-day course to really hit everything that I was hoping to find, and I feel good going back into practice now to start placing implants.